We're talking really about trying to keep people out of the hospital environment if we can in any way. Ventures that have spun out of the Clinical Science and Engineering Research Center at Binghamton University. I'm CEO of Sonostics. So I'm going to focus on supersonic ventures are collaborating to come up with smart. The gist of Sonostics is that some of you talking to you at the reception know, most of you probably don't realize you have 3 hearts in your body, but in fact you do. And your secondary hearts are rather important. If you have heart failure, you are going to be, in the early stages, you're going to be experiencing these kind of symptoms. Chronic unexplained fatigue is probably the most common symptoms, but you're going to have symptoms of dizziness, you're going to notice swelling of the ankles or feet, varicose veins is a nice thing. Uncontrolled blood pressure could be very low, it could be very high. For women, first thing they'll notice is chronically cold hands and feet. And what this means, you have poor circulation. And yet, in the vast majority of time, when you have symptoms of heart failure, you go to the doc, they work you up, they can spend 3 days in the hospital, they're going to say, your heart is perfectly fine. Okay, your heart is fine, but what heart failure means is you're not pumping out enough blood. And the way the heart works, there's no reservoir in the system. The only way you can pump out enough blood is if enough blood is returned to the heart. And so the vast majority of the time, what's happening is you have insufficient fluid returned to the heart. And it's your second heart that's responsible for doing that. And so what Sonostics does is, in fact, develop and build secondary heart pacemakers. In fact, as of this past October, they put their first product onto the market. This is a representation of it. In fact, over in the, am I pointing in the right direction? I think I am. There's a demo, so you can try it out after the talks are over. But the gist of it is, by stimulating a postural reflex arc beginning on the plantar surface, the sole, I have to put the word sole into this talk because I promised earlier. By stimulating the mechanoreceptors on the sole of the foot, you can stimulate a reflex arc that will get the soleus muscle to contract, and we'll talk about the soleus muscle in a bit. But you can see an example here on the right of what classic heart failure looks like. The individual sitting down, all of you have been sitting now for roughly half an hour, and so you're in the state of the individual you see here. This is a 60-year-old individual, but as you sit, your cardiac output drops and drops and drops. And it should drop down to roughly where that dotted line is. And I have a pointer, but I don't know how to point. But it usually starts up high. It will decay by about 30%. We'll see why in a minute. And it should level off at that line. But you see this individual plummets below that line. But with secondary heart stimulation, you can see it's pushed back up. In roughly an hour, it's back to roughly the normal level. And in fact, if this individual had started with this device when they first sat down, it would have stayed at the normal level. So that is the product. That's what we mean by kind of a secondary heart pacemaker. What's actually going on here? And what's going on here, I suppose in honor of the 100th anniversary of general relativity, is that we have this thing called Spacetime, or what the rest of us would call gravity. We're very large animals, and we do this most of the time. We stand upright, we sit upright, and our heart is quite high in our body, and so most of the fluid in our body is below our heart. And so gravity grabs this fluid, it pulls it down. When you're standing, within 30 minutes of taking a standing or seated posture, about 15% of your blood is pooling down into the veins of the lower body. That expands the capillary bed. And so not only do you lose 15%, but you lose another 15% of your blood, roughly, through what we call extravasation, or moving out in the interstitial spaces. So you've been sitting there for half an hour, and roughly you've lost 30% of your blood. And so your cardiac output has dropped by 30%. Now, fortunately, you're just sitting there, and so you don't need a lot of blood flow to sit more or less passively. And so that works fine. Okay, but why does it just stop at 30%? And it stops at 30% because you have secondary hearts. You have a soleus muscle in the back of your leg. This is the gastroc. This is this big muscle in the back, behind your calf. And this is the soleus muscle. This is a specialized muscle, just like the cardiac muscle is a specialized muscle. It has venous sinuses in it that slowly fill with blood. I'm standing, you're sitting, slowly filling with blood. It will fill for a minute or 90 seconds, and then it contracts very slowly. It takes it a minute or more to contract, and it's doing this constantly. If it were not doing this, you would not pool 30% of your fluid in your body into your lower leg. You'd pool 100% of it, and you would pass out because there would be no blood to pump up into your brain, and you wouldn't stay conscious. As you're all more or less conscious, it seems. I had a glass of Pinot Noir, so I'm borderline conscious. So, at any rate, so it's a rather it's a rather critical muscle. What we're doing at Sonostics is activating this muscle. So it normally has a stretch reflex. And so as it expands, it stretches, it triggers a stretch reflex, and it will contract. But when we do this, and this is what we all do 8 to 10 hours a day now, and that stretch reflex is lost. There's a remaining postural reflex. And the pacemakers that are developed by Sonostics utilize that secondary postural reflex arc to get this muscle to contract. So by activating the postural reflex, you can get the soleus muscle to contract. So it paces, it's a pacing. So it will stimulate the soleus for a minute, and then it will allow the soleus to relax and fill, and it will stimulate for a minute. And again, if you want to try the demo, you'll get a sense of how it works. So this is a fairly huge market. It turns out about 20% of people, in fact, you may have recognized yourself. If you didn't recognize yourself, you may have recognized a sister or a mother or a relative of some sort in that list of symptoms. About 20% of people have one of those symptoms I pointed out earlier to a degree that it significantly affects their quality of life. So there's about 200 million adults in the United States, 20% of 200 million. If they purchased a heart partner device, the Sonostics device creates a addressable U.S. market of about 24 billion. So this is a fairly substantial market. Not nearly as big, though, as what we spend on treating heart failure. So if you catch this early and you make sure that, in fact, the blood's coming back to the heart, we're going to have far fewer cases of heart failure. And as I tell my students, our job really is to shut down all the hospitals. If at the end of my life there are no hospitals, we would all be very happy, because do any of us really want to go to hospitals, right? So that's kind of a decent career goal, right? So the company is pursuing this 3 markets, the direct-to-consumer market through an e-commerce site online. The major focus, though, is employee wellness. Indeed, why we're developing secondary heart insufficiency is because at work we sit all the time. And employers are very concerned about the productivity and the morale and the health of their employees, particularly in changes in the healthcare market. So we're working with groups like Walmart headquarters alone has 14,000 employees who essentially sit all day long. Lockheed Martin down in our area has about 3,000 desk employees. Law firms are paying their employees $500 an hour. Do you want $500 an hour employees to be cold all the time and can't type on their computers because their hands are cold, their feet are cold? We're also working with workplace furniture firms, both manufacturers like Herman Miller, as well as office designers like Workwell Partners. And then in the healthcare market, primary care, nurse practitioners, and important, who tend to, in particular, who tend to spend quite a bit of time with their clients rather than writing a script and pushing them out the door. They're willing to say, you have alternatives here. I mean, there's not many alternatives to fluid pooling. Put your feet up. That doesn't work too well if you want to keep your job. Your boss could get a little upset about that. People don't love compression stockings. They do not like pneumatic compression. So nurse practitioners will walk through the options to a much greater degree. And then occupational health firms are our target focus. Here's the competition. I've talked about some of these. Workplace health, standing desks are all the rage. We don't want people standing. Standing up and moving is good. Stasis is a pretty bad thing. Space heaters is the next most common thing, at least down at the university. You can't walk into someone's office and not see a 1,500 watt space heater pushing out hot air, which of course triggers the thermostat to kick on the air conditioner to cool the room back down. So they're self-defeating. They cost a lot of money. They're self-defeating, and very few people get any benefit from them. And then there's Red Bull, at least for the young people. I've never had a Red Bull, but young people do seem to love this stuff. We've talked about lower limb fluid pooling and compression stockings, which people uniformly hate, and obviously you're immobilized if you're using pneumatic compression. Varicose veins, obviously we can symptomatically treat these, but we don't want to. We want to correct the issue, and the issue is a weak soleus muscle, a weak second heart. You train up the soleus muscle, and you clear out those veins, and they will correct themselves. You can block the veins, you can ablate them with lasers. They have super glues now you can inject into them. It's symptomatic correction, but you are not correcting the underlying cause. And then, of course, there's issues like the fact that you can't regulate your blood pressure if all the blood is in your lower legs and it's not circulating, and you're familiar with all of these things. And in fact, diuretics are usually the first intervention. You already don't have enough fluid circulating, and so now we're going to give you a diuretic to have you clear fluid. What's going to happen? In 2 or 3 weeks, you're going to crash and you're going to be in the ER. So that's the competition, and the heart partner device can really address all 4 of these major markets, and that's what we're focused on. But to tie into this particular conference, the question is, where's the IT part? Where's the smart part of this? And we're making this smart in the next generation by collaborating with another spinoff out of Binghamton University called infrasonic cardiac monitoring. And this is a recent PhD graduate who's developed a non-invasive way to monitor cardiac output by looking at chest wall motions. He's an expert in wavelet packet analysis. He monitors using the accelerometer the motion of the chest, and from that he can actually extract out the cardiac output. Okay, the amount, if he knows your body dimensions, your chest diameter, your height, he can give you your actual cardiac output. So what that means now is, as we go to the next generation, we can make this smarter. We want to take this out of being a floor-based appliance to being a small device, an electronic device, and this is the prototype device which has been tested, and not only does it work as well as the mechanical device, it works better than the mechanical device. Embed this into the sole of the shoe. The sole of the shoe, this device will communicate through Bluetooth with the cardiac monitor. So this is battery operated. We want to save the life of the battery as much as possible. So why stimulate the soleus? In fact, if you're up and walking around and the gastroc is compressing the soleus and you're getting plenty of blood return back to the heart, you only want to use it when you need it. So these two devices actually talk to each other, causing the soleus stimulus to be activated really only when it's activated. So that's the smartness of it. And of course, what we can also do pretty easily is communicate back to the user, to their phone. So a little app on the phone, and you can see you start using this, and your soleus is being triggered 6 hours a day. And then after a couple months, you see it's 5 hours a day, and then it's 4 hours a day. And you can see your soleus being trained up, and at some point, your soleus is back to health. And at that point, you're in pretty good shape. You do have to be taking vitamin D, I'll point out, because the most common reason for losing a soleus, what that really means for at least one person who's nodding and understands muscle physiology, it's a conversion of type 2A fibers to type 2Bs. And if you don't have enough vitamin D, you will not get those converted back to type 2As, which is essentially what we're doing. That's far too technical, I can appreciate that, but at least one person really appreciated it. Okay. So here's our team at the current time. This is me, obviously. Chuck runs operations. Jerry's right here. If you're interested in buying a unit, he will sell you a unit because they are commercially available. Tista runs our clinical trials, and Donna works with the nurse practitioner. She's a NP and PhD, so she's doing our primary healthcare outreach. And that is our story. Thank you very much.
Minutes for Q&A if anyone's got a question.
Bill Cunningham. How's this being applied to the primary, but to the doctors, cardiologists?
I have to admit, for rheumatologists working with fibromyalgia patients, possible. So rheumatologists will send us fibromyalgia patients because there's no kickback. They're not writing. Exception would be nurse practitioners who really do want to better. So that's why they like to see this spread out into the GP population without question. Sit in the two back, or are you just going to?
Doctors think about this technology. Are the doctors from these devices?
Well, right now,
I mean?
current version, they're not getting any information. There's certainly pushback. I mean, we get people buying the device surgery for their varicose veins. That does not make vascular surgeons very happy. I'm an iconoclast, and I don't mind making enemies. When you have an electrical, so and so we see a lot of acceptance. The docs, even the cardiologists coming out of Israel, just glad of the preload and enhanced. All the drugs we have work on the arterial side. So we have in most cases, in a remarkable number of cases, over 50% of cases, and you're still hypertensive. Why? Because all this fluid pulling into your resistance, and now you have high blood pressure. It's not rocket science. So if your vascular pressure is high, no matter how little your cardiac output is, you're going to be hypertensive. Is in the tank. So they just see this instantly. I hate to say this, and I talk American-trained docs, I have to admit. Is Israel right there on the edge somewhere? Okay. Yes?
So once you use this device, you see now what do? We go back to the same doctor? What he's going to tell us?
See, I taught in med school for so what usually happens is that they go to a car, it's perfectly fine. And so then they end up, then this is recommended through some strange pathway. They don't usually find us on the net. They find us through word of mouth. Chronic fatigue has disappeared. A woman last year who was on 5 meds, her kidneys were being damaged, and her doc said you're going to have 2 meds now and her blood pressure is normalized. What I didn't ask her is, does she go back to her doc, her same cardiologist? Americans love their doctors. This is why HMOs didn't work, right? I don't know the answer to it. If I understood your question correctly. Okay.
Thank you, Ken. Understanding of the Soleus.